the end of the impeachment saga. There is no end of the impeachment saga, at least not yet. So maybe we can talk with our guest, Rick Manning, who is president of Americans for Limited Government, about something else today and the end of the saga and the President's State of the Union speech, which is coming up. Is it tomorrow? It's kind of hard to tell. The President might be running out of time.
The State of the Union is tomorrow.
Okay.
And there are those who believe, and I might be one of them, that the whole reason the Senate didn't wrap up the impeachment stuff on Friday night, beyond them not want to work that late, was because the number of senators wanted to force the president to have a State of the Union address before he got acquitted. So they delayed it to Wednesday for the acquittal vote, so the president couldn't brag about being acquitted.
Well, okay, I guess.
Well, it's Washington D.C.
Right.
I mean, it's Washington D.C. It is.
Sure.
Think of Mean Girls. And your worst high school nightmares about people doing bad things for irrational reasons just because they can, and then give it a whole bunch of power and gigantic egos. And that's what you get when you're dealing with Washington D.C.
All right.
It's why it's a swamp.
All right. Well, let's change the topic up for the sake of today, only
Sure.
because we thought there would be less to talk about today than about impeachment. We can maybe do that tomorrow. Surprise medical billing. One of the things that the president has been working on that is an actual issue for people who have a hospital bill. They open that envelope and kaboom, surprise, it's considerably higher, sometimes astronomically higher. How is that going to end with President Trump's legislation?
Well, there's actually competing pieces of legislation. One of the pieces, which is supported by the health insurance companies and being pushed hard by them, would be a flat kind of fee across healthcare fees across the nation. It is one size fits all health fees, and when you get down to it, in places where they've tried it, like California, they've seen health providers leaving and no longer providing health coverage not health coverage, but actually providing health services because they were losing money on it because the health insurance people were setting the pricing, and you get down to it, they're setting the pricing based on what gets them the maximum profit, which means it doesn't mean that the guy who's actually seeing you, your doctor, can afford to see you with that price.
Right.
So anyway, that's one of the items. We're dead set against that. The other one is to still take the patient out of the squabble, but to create an arbitration system where the health provider and the health insurance company go to local arbiters and make a decision on what's fair and what's not fair in terms of the increased costs. And that way you've got at the very least, the patient doesn't feel the pain. It's a fight on who gets paid between the health insurer and the provider, with the health insurer making the argument that it's out of their network, and so they don't want to pay as much as the out of network stuff is, and the health provider is saying, this is how much it costs me to do it. I have to make a profit, so this is how much I need to get, and it puts it into a legal battlefield as opposed to making it show up in the patient's bill and make it. And then the patient sits there and tries to figure out, how's this my problem? My insurance company won't pay the bill that was submitted to them.
Well, and
so that's the most likely. Those are the two solutions that are being bandied about.
Everybody listening that isn't on Medicare has gotten a bill from their provider that said, "Hey, you recently went to the hospital and had an appendectomy. We think the appendectomy should cost $100. Your medical facility charged you $250, so we're going to cover the $100, and you're up for the other $150." That's not what any patient is in for. That and the fact that getting an appendectomy at one hospital is this much money, going to a different hospital in a different state is a considerably different price. People are going to be shopping for procedures state by state if it continues this way.
Well, and I would argue that'd be good for the pricing model. So, if the consumer starts paying attention to what the price is, that's actually good, because then you're not getting ripped off. But the challenge of what the debate is right now, if you're sitting there where you don't get, surgery, you don't get to decide, I use this kind of clamp versus this kind of clamp,
right,
and I put this kind of mesh in to fix a hernia rather than this kind of mesh. So those aren't things that you actually decide. If you're in an emergency situation, you're sitting there knocked out and they're trying to fix you and try to save you, and then wake up and discover your health insurance only covered 47% of the costs, and you're going to get dinged for the rest. It's kind of why you're buying the health insurance, is you have the assumption that is going to cover your costs up to a certain level of payments, and you buy your health insurance with that expectation. And quite honestly, the health insurers have a responsibility to make certain that the amounts they charge are fit within what the costs are.
Right,
and then. So that's where I'm coming from.
Nobody tells the patient, by the way, your doctor, the nurses, the facility, they're all in your network, but the anesthesiologist is not. So you're going to get a bill from us that you're going to expect. The anesthesiologist is out of the network, and his bill is going to be considerably higher. So stand by for a gigantic bill. That's not fair. You shouldn't have to open that envelope and have a heart attack.
Well, yeah, and you exactly right. The medical costs for treating you after you've opened the billing envelope are probably higher than the medical costs of actually treating you up front. But it's not fair, and and so I think they're going to be dealing with this. It becomes really important as we have the Iowa caucus tonight, because Bernie Sanders, most people believe Bernie Sanders will win the Iowa caucus tonight, and that puts Bernie care right front and center in terms of an issue that's going to be really dominate, I think, in a lot of the conversation in the presidential campaign. And if you do the plan that the insurance companies want, which is one size fits all medical billing, besides the problem of providers deciding that they can't afford to provide certain services under that system, besides that problem, you've also set the stage, taking care of one of the most difficult aspects of imposing one-size-fits-all universal coverage, socialized medicine, because you have already determined the pricing structure, and Bernie Sanders would just say, yeah, that's the pricing structure, we're just taking the insurance companies out of it and replacing it with the government.
Right. Well, and the issue then will be insurance companies go out of business. They're all unemployed. And doctors who have been working very hard to become a doctor who may be a specialist says, you know what, I'm just going to do concierge medicine from now on. And those of you who are getting this fabulous universal government-provided health care can sit and spin. Find your own doctor who graduated 111th from 113 people in medical school.
From St. Bart's Medical School.
Yeah.
Quite honestly, if Bernie Care goes into place, my bet is concierge medicine will pop up on the Indian reservations. Oof. Because they have different rules and regulations, and you can have a concierge medicine there. And it'll be one size fits all. You can gamble. You can go to the pot dispensary, and you can get your appendix out all in the same place. Yeah,
yikes! There's clearly something to watch. It'll be interesting to see how the Iowa caucus weighs in on this issue with Bernie Care, for instance. Bernie Care, I hadn't heard that term in a while. The Iowa caucus is tomorrow night. We'll talk. Rick Manning from Americans for Limited Government, thanks this morning. The impeachment extravaganza is not over. We'll continue that conversation tomorrow. The Iowa caucus is 2. In the meantime, a little business to take care of, and Lacrosse Talk continues.
Troy and